Hey, good morning. It's Patricia Murphy. It's Wednesday. This is Seattle Now. The pandemic has rocked our world. We have all individually and collectively been through a series of life-shifting events. And for some of us, it's taken a toll on our mental health. Dr. Mauseth is here to help us understand what the path forward is likely to look like. But first, let's get you caught up. New state health data confirms what many health officials have been warning about. The number of people dying from drug overdoses continues to rise. 2,000 people died from overdose in 2021. According to the Department of Health, that's a more than 66% increase from 2019. Officials say more than half of the deaths are because of fentanyl. They warn people who use drugs should consider carrying at least 2 doses of naloxone with them to help prevent death from overdose. Keep all your layers handy. Spring is a free-for-all around here, and the National Weather Service says it's going to stay chilly for a while longer. You may even spy a snow shower this morning and overnight during the coldest hours, maybe a bit of rain during the day. And it's the holy month of Ramadan. For Muslims, a time of prayer, fasting, and worship. Gathering together is a big part of Ramadan celebrations, but during the pandemic, of course, those events were put on hold. Today, for the first time in 2 years, the Muslim Association of Puget Sound is having its interfaith Ramadan celebration in Redmond. More than 300 people are expected to break bread together at sundown. The pandemic has been rough on our mental health. We have all been through it in one way or another. Some people got anxious and depressed. Some thrived during lockdown, but are struggling with reentry. More than 2 years later, COVID feels less threatening, but the world is definitely different, and so are we. No matter where we're starting, there are ways to think about the future that can help. Dr. Mauseth is here with some perspective. She studies behavioral health around disasters and co-leads the Department of Health's Behavioral Health Strike Team. Kira, really glad to have you back.
Yeah, it's my pleasure. Thanks for having me.
Yeah. So you use an outline in your work of how people respond to disasters psychologically, and it goes through different stages. Let's talk about them. Where do we start?
That's a great question. I guess the very beginning, taking us back, would be mid-March of 2020, which is when the initial impact phase for the pandemic took place. Yeah. And the impact phase is typically a short-term thing, either hours to days, and then it moves into the honeymoon and the heroic phase, which is about a month or so after impact. And then from there, we proceed into disillusionment. So that's about 6 to 9 months post-impact. That was over the fall and winter months of 2020 into 2021. But then what happened, if you remember how 2021 went, which, seems like 5 years ago, but also last week, we got into the summer of 2021 and the state was reopening and it felt great and people were feeling optimistic. And then Delta happened. And that was in August, September. And that created what we refer to in disaster behavioral health as a secondary impact. So it starts the whole cycle of all of those phases that I was just mentioning all over again. And we started to recover from Delta, and then Omicron happened. So at this point, nationally, we have experienced at least 3 large-scale impacts in the last 2 years. Certainly regionally, there have been other impacts from, weather-related disasters and other events. So at least 3, potentially more, large-scale impacts, depending on where you are in the country.
That is fascinating. And there is so much in what you said. And as you're running through these stages, I can feel it. The heroics, the whole healthcare worker surge. We love you. That second disaster, that Delta surge, that Omicron surge. Yeah. Really, really fascinating. What does that secondary impact do to us?
Well, you're starting from a lower baseline. That's the biggest thing, is that you're already tired. Your mental and emotional and psychological resources are already slightly depleted. So it feels more challenging. And in many cases, as we started the school year for 2021, the fall, even though kids were going back in person in almost all cases in Washington, this school year felt much more challenging for educators, for parents. We were navigating quarantines and a lot more unknown, even though online learning was not ideal in so many ways. There was so much more upheaval this school year. There were, educators acting as first responders because kids were experiencing so much crisis in school. So disaster cascades although not uncommon in the world, are very, very challenging. And they prolong the recovery process for all of us.
Yeah. And the term I often hear from people who are struggling right now is that they feel depleted, right? Mm-hmm. They are depleted, which is a lot of where many of us are coming from right now. Okay, we've been through these three impacts. At the same time, things are looking up for a lot of people. What do we see now?
Well, as we move into the spring and into the summer months, the biggest behavioral health sort of concern on our radar, on our team's radar, is the sort of deep physiological and neurological need to blow off steam and have fun and just really have a good time. The risk is around doing those things in an unsafe way. It's such an impulse that we have to just want to have fun again and live a little. And especially for adolescents and teenagers, where consequence consideration isn't obviously always a strength for folks. It's a big risk when it comes to things like substance use or risky sexual behavior, maybe drinking and driving. These are risks that typically increase with the warmer weather and the longer hours of daylight anyway. But when you layer that in with the disaster cascade and the general need to recover and move forward from the pandemic, we are trying to get the word out as much as we can about supporting adolescents and teenagers and all of us making good decisions and having a good time, but doing so in a way that's not going to cause longer term negative consequences.
That is such a human response, Kira, to just, go bananas. We're free again. We're going to do what we want to do. And you see that, right, with the mask mandate. Some people, I'm never putting a mask on again. Other people have dug in, really dug in, and said, I'm never taking mine off.
Yeah, exactly. There's a huge variation in people's comfort levels and people's willingness to re-engage in a way that they feel safe and in a way that makes sense for them in their lives. So there is a huge spectrum of response that's fairly likely. In disaster psychology, we talk about acting out and acting in, and the response that people are having right now to the reopening of things is very much consistent with that. Acting out is when you express your distress or your excitement externally. It could be a lot of excitement. It could be a lot of aggression or even hostility. And acting in is the other side where you express yourself internally, where people kind of shut down or withdraw or don't participate. So those behavioral manifestations tend to come on opposite sides for folks.
Fascinating. Really fascinating. So the last stage in disaster response is getting back to some kind of baseline. And what does it even mean? This is fascinating to me because it seems like we don't have a baseline right now because we are all totally different people. So this is a curious question for me.
This is an exciting thing for me as a clinician. I choose to see it as an opportunity for people. I would love to encourage people to think about the pieces of their lives and of themselves from 2019 that they'd like to leave back there, that we'd like to leave behind and say, no more of that in terms of, my connections maybe that weren't healthy or my relationships or my job or whatever it was. And be intentional about moving forward in a way that really represents who you want to become as a person. There's really nothing like a large-scale disaster that gives us the opportunity as human beings to reevaluate and to kind of decide for ourselves what we want things to look like. That doesn't have to be intimidating. That can be exciting and a sense of opportunity.
What a brilliant perspective. Honestly, what a brilliant perspective, Kira. The resilience of humanity in here maybe is super helpful.
Yes.
Where do we draw that power from, though? Because a lot of us have been stuffing it down, right, during the pandemic, just surviving.
A lot of the discontent for people has been in the form of powerlessness. We haven't had control over what's happening with the rules and the expectations or the virus itself. And so finding empowerment as we move forward, in my opinion, at least, is going to be one of those foundational pieces of recovery. And we do have that. We have those opportunities to be intentional about our process. And what I mean by that is each of us have control over the way we interact with people, how we respond, how we listen, how we act. Even if we're not always in charge of content, we can control process. And that is very empowering.
Yeah. Kira, how are you thinking about the coming months here as hopefully we stay in variants of less concern? What do we all need?
I think we need to be intentional about having a good time, doing that in a safe way, having fun, reconnecting with loved ones and friends, getting outside. Being outside is related to all kinds of really healthy psychological outcomes for folks, really taking advantage of the spring and the summer months to be active in our choices. I don't mean necessarily like signing up for a triathlon or something like that, but active in engaging in our own lives for sure and not stagnating.
Yeah, I think the one thing the pandemic has revealed is how important relationships are and how connecting with people you haven't seen or enjoy connecting with can really, really be fulfilling. What can we do for the people in our lives who are struggling and who need support?
One of the best things that we can do in collective disaster recovery is to reach out and check in with folks, engage in something that we call active listening. It's a term from clinical psychology that just generally on a public level we don't do much of, but we all could do more. It's just listening to someone else with the intention of understanding more about their experience, not trying to convince them of something or tell them something or jump in with your part, but listening to try and understand what they feel like and what they've been through. That actually increases connection pretty deeply amongst people. And it's one of the most essential elements of recovery that we have available to us.
Dr. Kira Mauseth, clinical psychologist and disaster response expert, really appreciate your insight. Thank you so much for your time.
It really is my pleasure. Thanks very much.
Thanks for listening to Seattle Now. Special shout out today to Derek in Northgate, Kelly in Seattle, and Fran in Port Orchard. Thanks so much for your donations. We can't make this show without you. If you want to contribute and hear your own name in our credits, check out the link in the show notes. Clare McGrane produced today's episode. Matt Jorgensen does our theme music. I'm Patricia Murphy. See you tomorrow.